Hello viewers and learners, welcome back to this important session on research process. You have already seen that the planning phase of research process is a very important phase of research, because in this the researcher decides about everything, whatever he is going to do, the steps, the problem identification, the conceptual framework, the sample, the tools and all that. And we have focused earlier on the statement of the problem, how to identify the problem and how to state the problem, and also we have focused on how to review the literature. Now I would request Dr. Poonam Joshi to talk about hypothesis, how to formulate the hypothesis, what are the characteristics of hypothesis, and then what is different types of, how the different types of hypotheses are used in the research.
Thank you. After having completed the review of literature, now next step is formulation of hypothesis, and simultaneously we keep on looking for an appropriate conceptual framework for our study. So let us discuss what hypothesis is. Hypothesis is a kind of prediction you are making in relation to two or more variables. You have dependent variable, you have independent variable, and you are trying to establish relationship between the two, that is hypothesis. So hypothesis, some people call it to be a tentative assumption which may or may not stand true. So you have to always decide a level of significance, because this is very much essential as far as statistics and research activity is concerned. It has to be logically tested. Hypothesis should be very specific, and it's a very precious piece of research in hand, because it has to be tested very carefully. And remember, it may not be true all the time, so that's why we always keep ourselves handy with two types of hypothesis. One is the research hypothesis and other one is the null hypothesis. So in initial phase, when we are stating hypothesis, there we have a research hypothesis, but when we are trying to analyze our result, we always do in relation to a null hypothesis. So hypothesis role is very important. It is going to guide the researcher. It is going to keep the researcher on a right track, and it's trying to delimit the area of research and keeping the researcher always on the right track. There are different types of hypothesis. Depending upon the number of variables, you can have a simple hypothesis or you can have a complex hypothesis. Simple hypothesis means you are going for one or two variables. You are trying to see the relationship between two, that is simple hypothesis. Let's take an example of simple hypothesis. I am interested in knowing the effect of simulation on knowledge of my students, nursing students. So this is a very simple hypothesis where I have two variables. The independent variable, also called the variable which I can manipulate, which is under my control. So simulation is a variable under my control, while the outcome variable or the dependent variable is going to be the knowledge. So how much increase I am expecting in the knowledge of my student, that is dependent variable. So this is an example of simple variable. Second is complex hypothesis. In complex hypothesis, you have more than two dependent variables. Like I am interested in seeing the effect of simulation on my students' knowledge as well as on their self-efficacy or their confidence or their satisfaction with the simulation. This becomes an example of complex hypothesis. Then we have associated versus causal relationship or the causal hypothesis. In associative, we are trying to associate. I can say that those nurses who have better job satisfaction, they are going to have less burnout. So this is an association I am trying to establish between the job satisfaction and the burnout. while in causal, it is the cause which is going to lead to an effect. Like I can say that it is the anxiety of the patient which is make him vulnerable to develop the infection. So I am trying to establish cause and effect relationship between anxiety or between anemia status and the outcome in the form of development of infection. So this is an example of causal hypothesis. Then third type of hypothesis is directional versus non-directional. Directional means I am giving direction to my thesis. Like this is going to yield positive effect on the knowledge of my students. I know simulation is going to help to some extent, but to what extent? I am saying I am highly confident that it is going to significantly increase the knowledge of my students. That is directional. I am giving direction to my study. While non-direction, I say that simulation has some impact on the confidence level or on the knowledge level of my students. That becomes non-directional, where I am not certain to what extent it is going to help. Or if when I am comparing conventional method like classroom method, lecture method or video assisted teaching with simulation, so I am trying to establish we see the relationship between the two variables by giving no direction to my hypothesis. The last one is the research versus null hypothesis. I told you research hypothesis is also called an alternative hypothesis. You can have more than one hypothesis in a study. Similarly, you can have more than one null hypothesis in your study. Hypotheses are considered to be mandatory when you are doing an experimental study. In survey, it is not necessary. You can have it or you may not have it. So now coming to the components of hypothesis, there are important components. Every hypothesis should have the following components, that is variables. Variables could be independent and dependent variables. Sometimes when we are not doing the experimental study or not doing a comparative study, there we can have simply the research variables. We can have demographic variables also under study. Then the nature of relationship between the dependent and the independent variable. The third is the subjects to whom it is going to get applied. My hypothesis is meant towards students. So in the hypothesis where I said the simulation effect is going to be better than the conventional, it's a directional hypothesis, it's a simple hypothesis, and it is also including my subjects. I am saying the knowledge of my nursing students. Then the level of significance, it is the level which I have decided well in advance. That is most of the time 0.05. That is the level of significance. Means out of 100 times, it is 95 times I am sure that my results are going to stand true. It's only out of 100, only 5 times I may be failing in my statement of hypothesis. And remember, it is always a declarative and is always in the present tense. So these are the things you have to keep in mind when you are formulating a hypothesis. Here, take an example. I want to just simply survey the knowledge and the attitude of our nurses towards biomedical waste management practices which are going on in the OT and the ICU. So here my variables, you can see the knowledge and the attitude. These are the variables which I am interested in to study, and biomedical waste management, it's an independent variable, while the knowledge and the attitude are going to be the dependent variables. Next, once we have formulated the hypothesis, we have looked for an appropriate conceptual framework, then we move on to selection of appropriate research design. Now, the function of research design is to provide information for collection of relevant evidence with the minimal expenditure of your efforts, time and money. We want to do our research activity very economically without wasting our resources in terms of efforts, in terms of time and in terms of money. And the research purposes, they can be grouped into 4 categories as we have earlier also said, and again we are re-emphasizing. They can be for the purpose of defining, describing, exploring, diagnosing or experimentation. So once you have decided the research design, then you are likely to move for the process of data collection. And for data collection, you require number of tools and techniques. So sometimes we are interested in doing the observations, like I want to observe practices in my unit related to mobile phone, or otherwise it can be hand hygiene practices. Self-report may be sometimes expressed in a socially desirable manner. Like we may say that I am doing it, but in reality I may not be. So it is you who has to decide the tool which is going to be good for my study. So sometimes we depend on observation, sometimes by personally interviewing. Interviewing is having an additional advantage of getting the information in depth. It's also very good for those who are illiterate, those who are not able to fill up their questionnaire. So for that reason, it is good to interview the people when you have a wide range of population, where you have lot of variation seen, where you have good number of illiterate people as well as educated. And the additional advantage of having interviewing the individual is you get lot of in-depth information. You get to see their gestures and you can ask them, you can further explore them, and you will be able to get more and more relevant information. And sometimes when the people are filling up the questionnaire, they have tendency to skip the questions, and you have no way to get those questionnaires completed later on. Then we have sometimes through telephone. So it is you who as a researcher, or it is me who as a researcher who is going to decide what is good for my study. Sometimes when you have shortage of time, or when you are planning to include a large population, say a state, in that case it is good if you mail the questionnaire and ask them to reply. And then through the interview, sometimes through focus group discussion also, we can go for data collection. Sometimes when we are interested in knowing the opinion of the people, we may go for some kind of scales. We can make an attitude scale, opinioneer scale. So these are some of the ways of collecting data from our.
There could be checklists also.
Yes,
where we can observation checklists
yes.
could be there, and there could be participatory and non-participatory observation, and there could also be the Likert scale, which is commonly used for rating sort of rating scale, which is commonly used. And there could be also in case of nursing research, there could be clinical performers, which are used, clinical documents, and also the equipments which
biophysiological parameters can be monitored, like vital signs we can monitor, blood pressure,
those are
pain
machine
assessment.
Devices are to be used for measuring the biophysical. So these all are very important areas, the tools of data collection.
Then you have decided for data collection, you have also done using appropriate tools. Then comes the data analysis. Now data analysis, again going to decode it first, and then you are going to enter in your Excel sheet, and then you are going to make use of appropriate descriptive and inferential statistics so as to analyze your data. And these days we are depending upon number of softwares available, like we have SPSS, we have Strata, then we have R. These are various softwares which can be utilized for analyzing the data.
Before we go to data analysis, I want to tell to the learners that the selection of tool is very, very important. Selection, because when you use the observation, when you use the interview schedule, when you use the checklist, that depends upon the type of research you have. So we don't have to say that everywhere we'll use interview schedule, everywhere we'll use opinionaire, questionnaire. No. It depends upon the type of study and the type of data you want to collect. And when this research studies are critiqued, when there is critical analysis of the research, then in that case what happens is that the research is critiqued on these bases, whether the tool was reliable, whether the tool was appropriate to the study, whether it could assess what the researcher wanted to assess. That is very important, because if you want to assess the practices of a person, if you want to assess the clinical skills of a person, you definitely have to use the observation checklist, and you also have to use some devices to identify what are the signs, symptoms in terms of vital signs, BP, all those things in the patient. So it depends upon the type of study where you can use. And mostly when we see the knowledge. When we talk of the knowledge and knowledge, attitude and practices questionnaire, while self-reports and tick marking is required, in those cases we prepare the structured knowledge questionnaire, and there could be some unstructured questions also, but normally we prepare the structured questionnaires, the structured opinionaires and the structured knowledge, and sometimes structured interview schedule also, with having some open-ended questions which give a researcher a time to really save the time, economy of time for data analysis during the period of data analysis. So it's important to mostly develop the for quantitative studies, develop the structured questionnaires.
So very rightly said, we have to have open-ended also questions included in our data, because you get variety of information, and that helps you in generating more and more knowledge, and you get lot of additional information other than what you have structured in your tool. Then we were talking about data analysis. Here again we have to ensure that our data is complete in all aspects. There should not be any missing entries. You have to contact your statistician so as to find out the ways by which you can take care of the missing data. It is at the time of data collection you have to ensure that data is complete in all aspects, but still if there is some missing data, for that always an expert's opinion is needed. You need to properly code your data, and there should not be any error in coding. Again, any error on your part can make lot of difference in your study findings. And then we analyze it, making use of the softwares. We have these days softwares available which are going to make the analysis very promptly, and we go for both descriptive and inferential statistics. In descriptive we go for mainly frequencies, percentage, then we look for mean, median, mode, standard deviation. I'm sure you are already well versed with these terminologies in research. And then when we talk about the inferential statistics, there we have different types of specialized tests available that you have to always ask the experts which tests are appropriate for my particular study. Then finally, the last step of our study is the interpretation and report writing. And in between, as I said, there are some steps, like don't forget to include pilot study in your actual study, which is a mini trial run out, which is helping you to know whether my tools are appropriate. Is there any deficiency in my tool, or is the setting appropriate? Will I be able to complete my study? So you are checking the feasibility of your study, the tool appropriateness, so that don't forget to conduct a mini trial run out of your tools as well as a pilot study before you proceed for final data collection. Now, after having analyzed your data, then you are going to make an interpretation. It has to be strengthened again with the help of discussion. And remember, in discussion, it is not simply stating the findings, you have to support it with the help of previous literature available. In the review of literature, when we were talking about, we say go for the literature which is of highest quality, which is having lot of evidence. And if you look at the hierarchy of the evidences, the systemic analysis, meta-analysis, RCTs, observational studies, these are having little higher position as compared to observational studies or survey or case studies or simply talking to the people. So always go for a good quality of reviews, because this review of literature is going to help you throughout your study. It is not just one phase, not just the second step. It has to be incorporated. It should be a continuous process. Keep looking for the new literature that is available to you, because this literature is going to find out what you are doing extra, what new you think you are doing in your research activity, and what gaps you have identified in the previous old studies. Then researcher has to prepare a report, and writing the report, this includes some preliminary pages where we have the table of content, then we have list of figures, then we start with a kind of acknowledgement. People who have helped you directly or indirectly need to be acknowledged for their efforts, for their contribution. Remember, research cannot be performed by one person. It has to be by a team. You are being guided by a number of people. The experts may not have direct involvement, but they were there with you throughout all the phases of research process. So remember to acknowledge them. Then we have a brief abstract in our dissertation, and followed by the detailed history. And we have all these 7 steps included in the form of different chapters. So this is how. And at the end we have some annexures included in our research writing. That includes all the important letters which you have done in the form of correspondence, and you have your important tool, you have your master data sheet. All these things are to be kept. Let's take an example here. I've got a problem statement. It is a study to assess the knowledge and attitude among the nursing personnel working in OT, ICUs towards biomedical waste management. So let us see what the research question you can develop. You have identified.
Before going to that, we have the analysis and interpretation was the last stage of the research process. So before we move on to other discussions, I think the students may like to know that we were talking about research design, and what is the difference between research design and research approach?
Approach is like how you are approaching. It could be a quantitative approach, could be a qualitative approach. But when we talk about design can be experimental or could be a non-experimental. In experimental, you can have a true experimental study, you can have a quasi-experimental study, or you can have a pre-experimental study. These things you will be learning in your research classes as they proceed.
Research methodology classes.
And then when we talk about non-experimental, there we mainly depend upon surveys, we could do kind of observations, we do comparative studies. So these are examples of non-experimental designs. And you have to decide, you are the best person for your study to decide how I am planning to proceed. You have to decide keeping in mind the resources available, the time that you have, the type of support you are getting, and the setting in which you are working. So keep all these factors in your mind while deciding the research design.
You said one of the important points when you were discussing that when they are developing the tool, what different types of tools have been discussed. But before they implement finally the tool, you talked about pilot study is must. But during the development of the tool, they have to think of the validity and reliability. So how do they do the validity and how do they do the reliability of the tool?
Validity means you have to make the tool valid by giving it to the experts. You can give to the experts available to you in the nursing profession. You can contact the consultants available, the doctors available in your unit, or otherwise experts. Like if your study is having some kind of psychological component, you can even contact the psychologist, whomsoever you think, or sociologist if it's a study related to some social issues of interest, then sociologist. So whosoever is considered to be an expert needs to be contacted. Suppose you are including a component of technology. You are developing an app and you want to see its effects. So there a technical person, maybe an IITian would be there, an expert to guide you related to the content.
Because we said this research is a systematic process and also a scientific process. So whenever we do any scientific study and whenever we prepare some tools, since it being a scientific and systematic process, we do not know whatever we have developed is correct or not correct. So for verification, we have to submit it to the experts, subject to its content validity, to identify whether your tool measures what it want to measure in your problem statement, in your objectives, whether it will accomplish your objectives or not. And that certificate is given by the experts. So normally we submit the tool to the 10 to 15 experts, so that they give their opinion, and you have to modify the tool, then again give it for reliability. And there are various methods for reliability which we'll be talking about in other sessions of the research methodology. But the most important thing which we discussed today is that how to formulate the hypothesis, what are the types of hypothesis, and when you develop the hypothesis, you have to be very sure that whether you are doing the simple hypothesis or you are using the complex hypothesis. And the hypothesis when used have to be in present tense. Rather than writing there will be, we have to write there is improvement in knowledge scores after implementation of this teleconferencing session. Then if we use demonstration while teleconferencing, if we also use the demonstration technique, then we can say that there is improvement in the knowledge and skills of the nursing personnel after this teleconferencing session. That means we are using more than one variable. That becomes the complex. And when we were talking about the directional and non-directional hypothesis, in directional and non-directional hypothesis, I have said that there will be improvement. If I would have said there will be change in the behavior of the students after teleconferencing session, so that is not a direction. But when I say there will be improvement in the knowledge score, that is directional hypothesis. And if we say there is change after this session, so that is non-directional. So we have to say in what direction, whether it is positive, negative and all. And sometimes the null hypothesis is written no. So we have to test the null hypothesis. Null hypothesis means when you write there is no difference between teleconferencing session and face-to-face classroom session when compared in terms of improvement in knowledge and skills. So that will be a null hypothesis. So these things are very, very important too. And when we talk of design is an overall print. So I think you all have learned in depth what are the steps of research process. I thank you very much for your detailed discussion and very simplified way of explaining the research process. Thank you very much.